Now, what menopause is that it's literally the stopping of the menstrual cycle. By dropping the amount of estrogen within the body, that actually really inhibits the collagen production cycle and actually leads to degradation and breakdown of the collagen that exists in the skin and the subcutaneous tissue. But the difference between menopause versus menopause is that for men, the hormone reduction does not happen over the course of 1 year, but rather happens very gradually over our lifetimes. For women, it's really just a true stopping point where everything comes to a halt, and it can be a lot to adjust to. You're feeling like your youth and vitality have been suddenly taken from you. Plastic surgery has been a great option for a lot of women who want to get that sense of self back. All right, welcome back everyone. I'm Dr. Saadat, a Beverly Hills plastic surgeon, and for today's topic, I want to talk to you about menopause. And if you're a woman going through it, I'm sure you know plenty about it already. But for the rest of you, I want to explain exactly what changes happen to the body through menopause and why they're so unique, especially for women as compared to the hormonal changes that happen to men. Now, what menopause is that it's literally the stopping of the menstrual cycle that occurs in women, usually around the age between 45 and 55, although there can be people who go through it younger or older. But the biggest thing that happens during menopause is that your natural hormones in your body, such as those that produce estrogen, are going to come to a stop or really slow down, and this happens very quickly. And when I mean very quickly, it can happen in the span of months to even a year. Now, what happens as a result of this is that estrogen is typically responsible for a lot of things in the body, such as mood stabilization, improving the quality of your hair, the quality of the skin, and general well-being of the body, including things such as improving bone mineral density, which is why a lot of women after menopause will end up developing things such as osteopenia or osteoporosis. But when it comes to your aging journey, the reason why menopause has such a big impact on it is exactly what I was saying as far as how it affects the quality of the hair and the skin and the proteins in the body. By dropping the amount of estrogen within the body, that actually really inhibits the collagen production cycle and actually leads to degradation and breakdown of the collagen that exists in the skin and the subcutaneous tissues, meaning the tissues that are underneath the skin. And estrogen loss also leads to things such as fat pad reduction in the face, so you lose fat up here in the temples, along the cheek area, usually around the mouth, and couple that with skin sag. That's why a lot of times women will come to see me after about 1 or 2 years post-menopause, because that's when they start to really notice that tired look setting in, because the estrogen is no longer flowing through the body. Now, other things that can also happen with menopause is, like I said, the mood swings and the shifts in mood. It's higher likelihood to have things such as depression or anxiety after menopause, because estrogen does provide that sense of vitality to women who are premenopausal, and once that comes to a complete halt, it can be very jarring and jolting to the body. So ultimately, I think in society we do not talk about menopause enough, because it is something that does affect women exclusively, although men are known to go through something called menopause. But the difference between menopause versus menopause is that for men, the hormone reduction does not happen over the course of 1 year, but rather happens very gradually over our lifetimes, which is why the results are not that significant, but it's also why you may see older men who are usually in their 60s and 70s that develop things such as breast tissue or more feminine features to the face, and that's because their testosterone levels are slowly starting to drop and their estrogen levels remain higher. So, for men, sure, we go through our own level of hormone change, but it's nothing like that of women's. For women, it's really just a true stopping point where everything comes to a halt, and it can be a lot to adjust to. So it is very normal for women who are immediately postmenopausal to come see me and request things such as facial rejuvenation, face lifts, eyelid lifts, and even sometimes body contouring surgeries, because at the end of the day, when you're going through that journey emotionally and you're not feeling very good about yourself, you're feeling like your youth and vitality have been suddenly taken from you, plastic surgery has been a great option for a lot of women who want to get that sense of self back. Now, I know some of you may say, oh, you should love your body for what it is and this and that. That's bullshit. I don't think that that's how the world works. At the end of the day, one of the biggest things about the human condition is that we will always seek vanity. We have been trying to alter our bodies since the beginning of time, and that is not going to change overnight just because you shame a random woman for having a single surgical procedure done. So if you're a postmenopausal woman who's interested in plastic surgery or are curious about what your options might be to tackle the changes that happen during menopause, contact my office, let's talk about it, and let's see what the right options for you are. And with that, go ahead, like, follow, and subscribe. Make sure to share this with your friends and family, and make sure to tune in next week for another episode with me, Dr. Saadat in Beverly Hills.